Hi friends, welcome back on Easy Learning. It's me Rifa here and this is my 9th episode. My today's topic is stages of labor. So before going to the stages, let us know what labor means. So here, these are the series of events which occur one after the other in the genital organ in order to expel the product of conception, that is fetus, from the womb through the vagina into the outer world. Okay, these are the series of events that take place one after the other in the genital organ in an effort to expel the product of conception from the womb through the vagina into the world. So here, before the stages of labor, there are certain premonitory stage which occur. Okay, in this stage there is increased uterine contraction, and this stage begins about 2 to 3 weeks before in the primigravida and about few days before in multipara. In this stage, the first one is lightning. So here, this is a picture of lightning. In lightning, there is descent of the presenting part into the pelvis. There is a reduction of the pressure onto the diaphragm, thereby the pressure on the heart and the lung is reduced. The height of the fundus is reduced. See here, you can notice the height of the fundus over here. Sorry friends. You can note the height of the fundus over here and here. The height of the fundus is reduced in this case. So next change which occur is the cervical changes, that is cervix becomes soft, 80% effaced. Effaced is nothing, it is thinning of the cervix. See, here is the thinning of the cervix, and this thinning of the cervix itself is called as effacement. This is the cervix where there is no effacement has taken place. Here, the thinning of the cervix itself is called as effacement. So it admits one finger easily and cervical canal is dilatable. So the next one is appearance of false pain. First one was lightning, second cervical changes, third appearance of false pain. This false pain usually occurs throughout the pregnancy. It is also called as Braxton Hicks contraction or spurious labor pain. These are more frequently occurs in primigravida than in multiparae. False pain are more often caused by temporary indigestion or by loaded rectum. It is dull in nature. It is confined to the lower abdomen and groin. May be associated with hardening of uterus. Usually, this pain is relieved by analgesic, laxatives and enema. Then, appearance of through labor pain. The features of through labor pain are the painful uterine contraction occurs at regular interval. There is a regular interval in through labor pain. The frequency, intensity and duration of this pain keeps on progressing, keeps on increasing. Okay, this is associated with show. Show is nothing, it is an expulsion of cervical mucus plug mixed with blood is called show. There is progressive effacement and dilatation of cervix. Next, there is descent of the presenting part, formation of bag of four waters, which I am going to explain you later. And this pain, it is not relieved by enema and sedatives. So now let us go to the stages of labor. When through labor sets in, the three stages will be noted. There are three stages in labor: the first stage or stage of dilation, the second stage or stage of expulsion, the third stage or stage of placental delivery and uterine contraction and retraction. Events taking place in the first stage of labor. In this, it is concerned only with the preparation of the birth canal. It begins with the onset of through labor pain and gets completed with full dilatation of the cervix. That is about 10 centimeters dilatation. Okay. So the phenomena during this stage of labor are uterine contraction or through labor pain. Here, uterine contraction occurs initially at an interval of about half an hour, but later it progresses. The frequency, intensity and duration, it increases. Okay, at first the pain is felt in the region of the sacrum, but later the pain will radiate to the lower abdomen and sometimes down to the legs. In some cases it may be associated with feeling of nausea. Sometimes the patient may even vomit. There is frequent micturition. Okay, so here, with each uterine contraction, not only the canal is opened from above downwards, but also it becomes shortened and retracted. There are some coordination between the fundal contraction and cervical dilatation called the polarity of uterus. While the upper segment contracts and retracts and pushes the fetus down, the lower segment and the cervix dilate in response to the contraction of the upper segment. Next is the mucosanguineous discharge. Just before the labor, there is an expulsion of the cervical mucus which is mixed with the blood, and this is called as show. This is the evidence for dilatation, effacement of the cervix and descent of the presenting part. The next stage is dilatation of cervix. Here there are contraction and retraction of the upper segment and lifting up and thinning of the lower segment, resulting in dilatation of the cervix. Okay, this is the cervix before dilatation. There is no effacement taken place. Here, because of the contraction and retraction of the upper segment, there is lifting up or thinning of the lower segment, ultimately resulting in dilatation of the cervix. Sometimes even the bag of membrane also plays a role in dilatation of the cervix. Now let me explain you what is bag of membranes. The membrane, the blue color one, the amnion and chorion are loosely attached to this decidual lining. When the fetus is in vertex position, the head being spherical in nature, it gets well fitted in the wall of the lower uterine segment and divides the amniotic cavity into two. That is, the first one, as it contained bulk amount of liquor, it is called as hindwaters, and the below one, which contains small amount of liquor, called the forewaters. With the onset of labor, the membranes attached to this lower uterine segment are detached. With the rise of this intrauterine pressure during contraction, there is herniation of the membrane through the cervical canal. This is the herniation which is taken place through the cervical canal, and uterine contraction generate hydrostatic pressure in this. Because of that, there is dilatation of the cervix. Sometimes when these four waters are absent, the presenting part itself, it puts the pressure and causes dilatation of the cervix. Here, the upper part of the cervix is muscular in nature, whereas the lower part is fibrous in nature, because of which the dilatation becomes difficult. But there are certain hormones like progesterone, estrogen and prostaglandins which plays an important role in dilatation of this. Now next, coming to the lower segment. This is, I can explain you clearly over here. During labor, under the influence of this uterine contraction, the uterus gets gradually divided into two segments. The upper thicker segment called the active segment and lower thin segment called the passive segment. The junction between these two is called the physiological retraction ring. So this ring, it is characterized with the circular muscle fibers. Okay. Above this ring is the contracting thicker upper segment, and below this ring is a dilating stretch lower segment which is thin. This ring, it becomes more prominent in obstructive labor when it is termed as pathological retraction ring. Here it is physiological. In obstructive labor, it turns as pathological retraction ring. Okay. This, during uterine contraction, the uterus get divided into upper thicker segment called the active segment, lower thin segment called the passive segment. Junction between these two is the physiological retraction ring. This junction becomes more prominent in obstructive labor where it is called as pathological retraction ring. Now let us go to the second stage of labor. It is also called as pushing stage, and this stage, it begins with complete dilatation of the cervix and ends up with complete expulsion of the fetus. This stage lasts for about 1 to 2 hours in primigravida and about half an hour to 1 hour in multipara. So here let me explain you with this figure. With full dilatation of the cervix, the membranes usually rupture, because of which large amount of liquor escapes out. Thereby, the volume of the uterus is reduced. Simultaneously, there is increased contraction and retraction of the uterus. There is increased voluntary contraction of this abdominal muscles against the resistance offered by this bony pelvis and the soft tissues. This is called as bearing down effort. There is always a tendency to push back the fetus again into the uterine cavity by the elastic recoiling of this tissue of the vagina and the pelvic floor. This is counterbalanced by the power of retraction. Thus, with increase in contraction and retraction, the upper segment becomes more thicker and the lower segment becomes thinner. Thus, the fetus is gradually expelled out from the uterus against this resistance offered by the pelvic floor. After expulsion, the uterine cavity is reduced in its size. Then comes third stage of labor. It comprises of placental separation, descent to the lower uterine segment and expulsion. This stage it lasts from few minutes to about 15 minutes. So first let us know how placental separation takes place. There is marked retraction of the uterus. As you can see, there is marked retraction of the uterus which reduces the surface area at the placental site. There is reduction in the surface area at the placental site. As you can see, to about its half. As the placenta is inelastic, it results in buckling. Here, there are shearing forces which are instituted between this placenta and this placental site, which ultimately cause its separation. The separation can be a central separation or it can be a marginal separation. After separation of the placenta, there is an expulsion. After complete separation of the placenta, it is forced down into the lower uterine segment or the upper part of the vagina by the effective contraction and retraction of the uterus. Thereafter, it is expelled out either by voluntary contraction of the abdominal muscles or by manual procedure. The control of hemorrhage. Hemorrhage here occurs because of opening up of few uterine sinuses. It is being controlled by three factors. The contraction and retraction of the uterus causes constriction of the vessels. The occlusion of the torn vessels themselves or formation of the blood clots which favors the closure of the lumen of the vessels. Then comes the fourth stage of labor. Here it is a stage of observation where the patient is kept under observation for at least an hour. During this, the maternal vitals, uterine retraction and vaginal bleeding are monitored. The baby is examined. This is done to ensure that both the mother and the baby are healthy. So this was the end of my video, guys. So I hope you like my video, and if you liked it, please don't forget to subscribe and like, and please do share. Thank you.